Dr. Bodunrin Osikomaiya is the Executive Secretary, Lagos State Government Blood Transfusion Service. She joins us now live for more on this development. The Commissioner for Health was quoted to have said that only about 14,000 out of some 20 million Lagosians donate blood on a yearly basis. Why is that number very poor, and what's really been done to reverse the shortage of blood supply in Lagos?
Thank you very much. First of all, many people are not well enlightened and educated about the need to donate blood regularly. So one of our mandates is to make sure that this awareness goes to all parts of the states, from the grassroots even to the corporate body. So we need to talk more about why you need to donate blood, the advantages, the benefits, and who does need blood. And there are lots of myths and scary things about blood donation that are not really true. So during this awareness periods, we have the opportunity to demystify these myths. Also, in the past, we had issues about accessibility to voluntary blood donation centers. Now, all state health facilities have been well equipped for voluntary blood donation. The Lagos State Blood Transfusion Service also has voluntary donation centers where people could donate blood. And just recently, Mr. Governor magnanimously gave us a blood mobile so that we could move to less accessible areas for them to donate blood at the comfort of their homes.
The economic dimension to blood donation, reported cases of people donating blood for money. What precisely should be the motivation behind blood donation?
The only reason why you should donate blood is just to save life, because the blood is made free in your body and it is there. So it should be for altruistic reasons, just to help one another, to help people you don't even know. But because of the economy, as you have said, many people do want to be given funds for it. And we have encouraged people that do it to please, instead of giving financial incentives, these financial incentives can be converted to foodstuffs, gifts, and things that will give them the good memory, as well as help them to advocate for more blood donation.
Is to give blood for free. Why then do we have reported cases of people having to pay for blood when they need it?
So you do not pay for the blood itself. The blood is free. But just as I usually say, when blood is collected from an individual, it can be likened to crude oil. You do not use crude oil the way it is brought in from the soil into your cars as forms of gas or to cook food. This blood needs to be processed and made appropriately safe for people to use it. So once blood is collected, it has to be screened for transfusion transmissible infectious agents. We have to do compatibility tests, that is the grouping and cross-matching. Consumables are used for it. So you're actually paying for the investigations that are done to make sure that the blood is safe and the blood does not cause diseases to people that get transfused with it.
Executive Secretary, Lagos State Government Blood Transfusion Service. Thank you for sharing with us tonight.
Thank you very much for having me all the time.